Now at 11, under pressure and overworked. Nurses so exhausted, their health and the health of their patients is at risk. Our exclusive On Your Side investigation into what is not being done about it. But first, tonight's winning Powerball number.
News 5 begins now.
Under pressure and overworked. Next, a News 5 exclusive. Nurses forced to work overtime, both they and their patients are paying the price.
If the general population really knew what was happening and the insurance premiums they're paying, they would be irate.
Tonight, Chief Investigator Ron Regan reveals the risks we all face when nurses work exhausted and sick.
Someone could die.
Yeah. Oh, yeah. Absolutely. Seen it.
Our exclusive On Your Side investigation. Next. Tonight, an exclusive On Your Side investigation. Ohio nurses either too sick or too exhausted to be on the job, and these are the people caring for you or your loved one. Chief Investigator Ron Regan is here, and Ron, you're finding hospitals know this and often fail to stop it.
Rob, nurses routinely work 3 12-hour shifts, but often much, much more, and the results can be tragic.
We started dating in '92. Got married in '99, but she was the most compassionate person.
Compassion led Beth Jasper to nursing.
Would do anything for anybody.
And it may have cost her life.
A mile and a half from our house, she fell asleep.
Falling asleep may have caused this early morning crash.
The vehicle had flipped and she was gone. She was gone.
Beth was coming home from another round of overtime. Was she often fatigued?
All the time. All the time.
Was she often overworked?
Yeah. Yeah.
And long hours and fatigue are harming patients as well. Records obtained from the Ohio Nursing Board reveal one nurse administered Coumadin, a blood thinner used to prevent clots, without waiting for test results. In another case, it was given to the wrong patient. The same nurse also failed to give a patient a vital drug used to control seizures. She blamed overseeing 20 patients with potentially life-threatening conditions, and 12-hour shifts may have been too much for her. Others complained of being sleep-deprived and fatigued from excessive amounts of overtime. Someone could be seriously harmed. Someone could die.
Yeah. Oh, yeah. Absolutely. Seen it.
This nurse remembers what happened one night on her shift.
And they don't often know that the reason that we couldn't do anything was because we didn't have the capacity to do it. And it's just horrible.
Horrible because under Ohio law, can a nurse say, no, I'm too tired?
Right now, no, they can't.
It's perfectly legal. Lori Hovanak heads up the Ohio Nurses Association.
They've worked their assigned shift, and they're being told, not asked, that they have to stay for another 4 or more.
Why? Too few nurses on duty, and hospital staffing plans required under state law often fall short, forcing some to work even if sick.
I literally, in between doing things, was grabbing a waste paper basket to throw up.
I was having heart palpitations. I was having anxiety.
And going home brings potential discipline.
I went home, but I got written up for going home.
You got written up. You were disciplined.
Yes, I got a written warning.
Why do these conditions exist in hospitals?
It's the bottom line.
It's profit.
Profit, absolutely.
Are you concerned that there's an emphasis on profits over patients and nurses?
Absolutely.
18 states have outlawed mandatory overtime, but not Ohio. And medical mistakes are a chief reason. This recent report by Johns Hopkins School of Medicine found mistakes are now the 3rd leading cause of death.
If the general population really knew what was happening and the insurance premiums they're paying, they were irate.
But hospitals know it. As far back as 2011, the leading organization setting hospital standards across the country warned the link between fatigue and adverse events is well known, as much as 3 times higher when nurses work longer than 12.5-hour shifts.
We haven't seen that issue.
You haven't seen that happen. The Ohio Hospital Association represents 221 hospitals across the state and believes requiring hospitals to meet increased staffing levels is not needed.
Mandating it through legislation is just not appropriate because hospitals need that flexibility to assemble their own teams.
Even when nurses are too sick.
I think I would be compelled to bring that attention to the supervisor.
Or exhausted.
If you were in the hospital bed yourself and you were critically ill and the nurse that was attending you was half asleep.
And my own personal care provider too, family member, my wife or somebody like that, I would hope that they would recognize that and go try to get help or bring that attention to somebody else.
It's horrible because oftentimes they feel like it's like a secret kept from the community.
And while nurses can be compelled to work overtime, work hours for both pilots and truckers are tightly regulated due to safety concerns and risk of fatigue. I'm Chief Investigator Ron Regan.
Wow. Thank you, Ron. And now the curtain's pulled back on that. Thank you, sir. So.